All right. Good afternoon and happy Friday, everybody. Thank you all for taking part in today's First Friday Professional Development Series. Today's topic is near and dear to my heart. As being a combat infantryman with 27 months of Iraq deployment, Purple Heart, I wouldn't be here today without committing to take care of my mental health and self-care. So improving my mental health didn't happen overnight. It took a commitment for me to hold myself accountable, even when I realized I needed help. As everybody knows, these past 22 months have been especially tough, mentally and physically challenging for us all. And to me, it's vital that we understand that it's okay to take a step back and ask for help. I can't stress it enough to utilize all the available medical, mental health, and employee assistance program resources available. And I'm happy to have two experts in the field join me today. Today we have Dr. Herb Kando and Deborah Redding Stewart presenting on today's topic of wellness, mental health, and self-care. And with that, without any further ado, I will turn it over to them. Thank you all.
Thanks so much, Thomas. Thanks for your service, today and in Iraq. So I'll introduce myself, and then Deborah, if you want to introduce, and then we'll start the program. Well, why don't you introduce yourself first, because you've been here for so much longer than me.
Okay. I'm Deborah Redding Stewart. I'm a licensed marriage and family therapist, and I work for Hancock College in the mornings. I do mental health counseling with the students. And then in the afternoons, I have a private practice. And, as Herb said, I've been here quite a while. I started teaching psychology for Hancock College in 1980. And then switched over to mental health counseling in 2007. So I've been here quite a while. And I'll let you introduce yourself.
Great. Deborah brings a wealth of experience. So she'll be presenting after my presentation, and I'll start. So my name is Dr. Herb Kendall, and I'm a California licensed acupuncturist in my 36th year of practice, private practice, and 6 years with a contract at Allen Hancock College. And I provide acupuncture, massage services, and guest lecturing to staff and to students. I've been teaching a movement. You maybe have seen me out on the quad at different times, teaching movement and posture awareness to students. And that's a little bit about me. I'm going to jump right into the presentation. Today, we want to talk a little bit about what are the healthy things that you can be thinking about with the transition back to work. So the overarching themes I want you to be thinking about are, what is it that we want to leave behind as we make this transition back to the office? And what is it that we want to take with us? What are some of the helpful, new values, self-knowledge, practical tools that we're gonna keep and continue? And then on the other hand, what doesn't serve us anymore and what doesn't serve others? So many people have a lot of common experiences that we'll relate to together, and there's some time for dialogue at the end of my presentation about that. And many of us have very unique experiences about what's taken place. So I want to bring the lens of some relaxation exercises, some posture awareness as the special sort of focus tool that I want to share with you today. And I think before I get into the PowerPoint piece about why this is important, I want to just give you a brief sort of sensory experience to take a moment and relax and unwind yourself and bring in some of the themes that we're going to talk about. So first, I just want you to be aware about how you're sitting and the position you're in. Toward the end, we'll stand up and move around a little bit, but right now you can stay seated. And first, just noticing where your feet are. If your feet are apart and on the floor and you're aware of your feet, and you're also aware of your tailbone, there's an opportunity providing a really good foundation for posture awareness. So sometimes when our feet are sort of wrapped up in the stool or crossed, we're not really providing the best foundation for posture awareness. So with that, the next thing I want you to think about is as a string from the top of your head that comes up to like the sky. So you feel this sense of lifting out of your chair, and lifting the spinal muscles and relaxing in that way. And the next thing is to think about the difference between the sort of a closed posture and an open, expanded posture. So often we're kind of leaning forward, rolling our shoulders forward because we're focusing with our eyes and nose on the computer. And what I want to share today is something called a power posture of the open heart, which means that you're connecting to your medium. Like right now, we're connecting to each other through this medium on Zoom, from actually physiologically from your heart. So the difference means that you're going to be sort of as if there's a little bit of a let's say a curtain rod going from the screen to your heart. What that does is it opens your shoulders out. It allows your neck to stay nice and long and for you to enjoy this sort of posture in a different way. So once you have that foundation with your feet, your tailbone, I call it sort of this sort of waterfall shoulders. With that foundation, you can relax your shoulders. You can feel that you're uplifting. Practically, that might mean that you need a little support on your low back. But typically, this posture is going to happen where you're using your own muscles. So, just in that position, take a nice relaxed breath in. And if you have a little bit of space, you can also open your arms out to the side. And we're just going to do a seated chi wash. So the palms are open this way. And you take a breath in with your arms out to the sides, over your head. And you exhale as your hands come down. So the lengthening the exhale tends to help relax a lot. So the palms are open, and as your arms come up, you take a big breath in, keep your shoulders relaxed, feel your feet on the floor, and nice exhale as your hands come down. So we'll do this several more times. It's going to open the diaphragm, the stretch of the arms, and the nice long exhale. So I'm going pretty slow, so you recognize this is already we're slowing your breath down, right? We're lengthening that exhale. So let's just do 2 more of these. Take a nice breath in. Feel that nice grounded base, nice exhale as they come down. And 1 more of these. Nice breath in. Feel that connection from your heart rather than from your nose and head. Great. And then let your hands be on your shoulders and just notice how those shoulders drop nicely. So with that, with that awareness, we're going to go into a little conversation about why this is important. And I'm going to go into a little piece about this now. And let's see if I can get this to work directly there. Okay. And interestingly enough, the play button is right behind the control panel of the Zoom to open up. There we go. I think I've got it now. Great, that should work. Is that coming through okay, Thomas?
It is. Thank you.
Okay. Yeah. So the tool that I want to bring to those questions we first started is using body awareness and posture as a vehicle for helping us be present in this transition and for stress reduction and relaxation. So what I want to share with you is, let's see if this will go to the next slide. Okay. It worked so good before. Let's see, I'm going to go out of this here. And why would I not be? This is what you hope doesn't happen. I'm going to, about, coming back to the office and coming onto campus, holding that intention of joy and collaboration and fellowship will shape how you hold your body. And I love this picture because you really see that, how that spark of emotion just shapes these postures.
We don't see a picture right now.
You don't see a picture at all?
Nope.
Okay, let's see how that is going off then. All righty. Are you getting something now?
Good to go.
Good to go. Okay. I think I'll just keep it on this one because I think it'll, let's see. All right, we'll click it this way then. So now you see the picture that I was talking about and how emotional intention shapes posture. So you can be thinking about when you're getting out of your car, coming to work, how how you're feeling emotionally is going to be manifest in how your body holds itself. The other thing itself is that posture itself, how you hold your body, actually affects and shapes your emotions. So, a collapsed posture tends to lead toward darker thoughts, and we'll go into a study in just a minute about that. So you can change your mood by changing your posture. Now, posture also expresses relationships. So how people are seated together and how they express themselves, you'll see, relationships played out in posture as well. And so we have the opportunity to sort of equalize our relationships with others with healthy, open-hearted posture. Our bodies themselves are instruments, and how we hold ourselves is like the tuning and quality of that ability to express our emotion clearly. Posture also shapes endurance. The way that you hold your body influences how you navigate through stress and actually how well you persist. One of the studies that I really enjoyed is a study that was done in the European Journal of Social Psychology, and they created a task that was impossible. And as you persisted through this particular test that would go on and on, they kind of looked at how long you would hang out, how long you could hang in there. And a upright, expanded posture like we just did allowed people to persevere much longer through the test. So how you hold yourself will help with the endurance and persistence. Another study is a posture and mindfulness. And so this was also in the European Journal of Social Psychology, and it looked at journaling thoughts of students through different postures that they were holding. And a confident posture tended toward positive thoughts, and a closed posture tended toward negative thoughts. This fascinated me and perhaps relevant coming out of the pandemic, and so many people have lost somebody or know somebody that's been lost, and family members. So how you hold yourself through a trauma has to do with how deeply those memories get imprinted and how you will recall the trauma later. So holding yourself up not only helps at the time, but it helps in the future in terms of how you navigate through trauma. So the last study showed changes in neuroendocrine levels in the body, that just what we did, even just those few minutes of posture awareness, within 90 seconds, we're changing our neuroendocrine levels. So that expansive posture that we just did briefly increases testosterone, increases risk tolerance, it lowers cortisol levels, and the collapsed posture has the opposite effect as well. And really, it just takes a minute or two to have that happen. My caveat about this is, this was a study that was sort of called power posing, brief nonverbal displays affecting neuroendocrine levels. They've redone that study and they found similar results. But my point is that there's more than just sort of power in that posture, say domination, but there's also the opportunity for relationship and listening. So our ability to hold a posture that is open-hearted also makes us better listeners. We're more present emotionally to ourselves and thus to others as well. I liked how Morgan Freeman said that the best posture is the next posture. So, it's not about some fixed, firm thing in our minds, but movement is normal and natural for us. So, so I thought I would take that same idea into a standing position, and then we'll come back and discuss some of those questions. So the themes that we're going to be looking at in terms of what we went over and we'll repeat is that sense of being grounded. So comfortable, clear grounding, whether you're sitting or standing. The string to the sky that helps elongate the erector spinae muscles in the back, which is really important. That sense of release and relaxation in the upper body, we call it waterfall upper body. And what pulls it all together is that sense of connecting from the heart. And that is both, metaphoric, but it's also ergonomic, because when you're connecting from the heart, your shoulders are dropped, your neck is long, and you have the opportunity to sit in a better position that is illustrated by the different studies that I showed. And of course, the breath is really important as well. So yeah, so with that, I'm going to take it off the slideshow. So you suffered through a short PowerPoint. And let's go ahead and bring it back to an opportunity to pull this into motion in a standing position. So with that, I'm going to ask you to, find a good position with your computer and go ahead and stand up. And we'll take the same position into a standing opportunity here. Let's see. Very good. So once you found a good position for standing there with just a little bit of space for yourself, make sure your feet are about hip width apart, and feel that idea of that string to the sky. And just a way to loosen things up so you're not feeling like this is some tight form, just take your hands and slide across your abdomen a little bit and allow yourself to rock from one foot to the other, just working a little bit with that posture and shifting a little bit of weight like a slinky from one foot to the other. Take the hands across the diaphragm, so you're opening up the breath. Nice relaxed breath. And now on the upper chest. Good. Now slap down your shoulder, down your hands and arms, kind of like brushing off that tension. Great. And then come up on the inside of the hands. Now, when we do the next one, if you have any issues with your back, don't bend further than you're comfortable, because this is the one where you're going to go ahead and slap the hips and slide down the outside of the legs, and just as far as you're comfortable. But if you can go all the way down and slap your toes and come up on the inside of the legs. So it's slap, slide down on the outside, slap, slide on the inside. Yeah. That level. Great. Good. And then back up again. So these are just some simple movements to help relax. This is percussion on the back. It's great to get the energy moving when you've been sitting for a long time. And you can take that same percussion right up to the heart. So much of the tension we feel is also in the head. So the next thing we do is hands over the face, through the back of the hair, and down the back of the neck. So breath in as your hands come up over your face. Exhale as your hands come down the back of the neck. One more breath in. And exhale. We're going to relax the eyes now, so rub your palms together. Palms are going to go over your closed eyes. Take a relaxed breath in. And exhale, and again, rub your palms together. Palms over your closed eyes. Take a breath in. And exhale, rub your palms together again. Nice big exhale. And this time, palms over your open eyes. And then with your palms over your open eyes, just relax all the muscles around your face, around your jaw, the neck. And then just gradually take it off and shake the hands. So we're just walking through a little bit of movements here. You can also stretch the wrists a little bit, opening up the fingers like spiders on a mirror is what I'm doing with these hands here. You can open up the carpal tunnel by putting your palms outward. Link your fingers together, rotate your wrists. These joints are so happy to get a little bit of support. Now roll your shoulders. Shoulder rolls back are really helpful to reinforce this posture awareness that I'm talking about. I'm kind of going up and down in the knees a little bit just so you can get your whole back involved. That's good. Great. And I will then take us to that same position we did before, which was called the chi wash. So your palms are open, you're standing, your feet are forward, palms up, and then hands come up over your head. Breath in and exhale as they come down. So we're repeating that movement that's called the chi wash. Breath in and exhale. Good. And breath in. Exhale. And we'll do one more of those. Nice breath in. Nice long slow exhale. So if the standing position, you can be thinking about the same things we talked about. That sense of the shoulders down, like sliding to your back pockets. You can think about a grapefruit under your neck that helps to open that posture up. And think about when you're walking and talking to others in a standing position, how you can connect from your heart rather than from your head. And see if that doesn't make a difference in the quality of your interactions together. Take your time getting back to a sitting position. And just to take this thought into how you're going to interact with your media, the opportunity here is that I'm sure we have better displays that are, we should be at an eye level with displays. Laptops aren't good that way, but for the sake of just illustration, I'm connecting here from my chest to center of my heart to the media in that way, rather than from my nose and head. So feel the difference of that opening, how that one tool can make a difference. Then if you need to engage, you can also tilt forward, lifting out of your chair, right? Sort of like keeping that length, and you actually get a little workout in your abdomen because you're working the muscles that way. So, and if the feet are a little bit forward from the knees, it helps you engage your pelvis. You can feel more connection from your tailbone on the chair, rather than having, the feet behind you. You can have them at least level or even a little bit forward, and you'll have more engagement with your pelvis as you're sitting. And then finally, in this kind of posture workshop is, with the cell phones, every 10 degrees takes us for 10 more pounds. Like, so if you're like this, you could be 40 pounds on your head. If we keep that idea about engaging from the heart, your elbows are supporting you, your cell phone is here, you're connecting from your heart, that'll keep that posture, nice long neck. You're going to save a lot of ergonomic problems later. In a longer version of this, we go into the health risks of what's happening with cell phones, and it's really kind of a silent epidemic, actually. So that's the tool that I want to send you out with. And in for me, it's one of the ones I'm most passionate about. It's like every day I get benefits out of re-engaging and improving my posture. And my patients that I see over the years, they don't need my skills as much when they're using these tools. So, see if you can make that happen in your day. So I want to just come back to that question in the next few minutes, having a chance to kind of maybe invigorate and move your body a little bit. So when we think about, what is it that you want to, take with you and from the period that we've had, what I would like to invite folks to either, speak up and share us what your story is, particularly like maybe adding one thing that you want to bring back into your role at work from having worked remotely. I think for me, there's something about self-reflection, taking a little more space. I slowed my schedule down. So that's the piece that I'll share, is like slowing the schedule down. So I'm interested in hearing what is it that you want to bring into returning to work with you that you kind of gained from the time of working at home. Yeah. Any thoughts on that?
Yeah, I can start. So one thing I found that I was doing when I was working remotely was I was taking some more time to get up out of my seat and walk around and get up and move. And so taking that 5 minutes of just, almost setting a timer every hour and a half or hour, and just reminding myself, hey, get up out of your seat, walk around, and get out from behind the screens is definitely helpful.
Absolutely. Absolutely. That makes so much. I mean, if you can move your body, you're going to feel the difference. Who else has a thought about what you want to bring with you back into the space? Please.
I think for me, this might sound weird, but comfort. You know, my cat would like scare the bejeebies out of people because she'd walk across my screen and they're like, what's happening? But you know, obviously can't bring my cat to work or my dog. But just kind of some of those comforts, whether it be like a throw or something to just kind of wrap up with, you know, if it gets chilly or whatever, but just kind of, and even, you know, like when I was working at home, I literally had a window behind each screen. So I was in a corner and I had a window on each side. My window's behind me now, but maybe to adjust my screen so that I can start peering out the window periodically, just to get a different scene or something like that. I think, so for me, it's some comforts.
I love that. It encompasses the sense of being gentle with ourselves and having been in spaces where we could self-nurture in our work setting. Now we're going to bring that back in. Thank you. Who else has a thought?
I have a thought.
Thank you.
The thought is that I feel like I don't have enough time to do that, that I'm going to be behind on something, or it's going to take too much of time away from getting what I need to get done. And before you know it, the whole day's done and I haven't taken a break for myself.
Absolutely. It's, you know, how are we going to bring the discipline of self-care specific to time management into our tasks at work? It serves us individually and it serves the productivity in the long run too as well. And yeah, in the chat, we have a comment too about getting up from the desk while working in the office, setting a goal of 2 walks per day with a minimum of 5,000 steps, and finding walking partners. So I think there's another point in there too, is how can we bring some of these ideas and gain you know, fellowship in what we're doing, and perhaps accountability, you know, and motivation through our relationships. So I think there's a lot in that suggestion. Yeah.
Well, the other thing is that if you do get up from your desk, then later on, you have individuals that say, well, that person was never at their desk. So with that, then you're held that you're supposedly not doing your job, that you're not away when someone comes, and depending on who's saying it, then you pretty much feel like, well, what's the point of me getting up? Because heaven forbid someone's perceiving someone as never at their desk.
So certainly bringing the aspect of communication with our peers and our, you know, coworkers and bosses to express our needs and gain clarity. I think, you know, I think one of the opportunities coming back into work too is maybe there were some missing pieces in communication with coworkers or you know, or superiors, and here's an opportunity to get a fresh start and to communicate. This is what I need to do, and this is why, you know. So you feel that sense of permission. I guess that's problem solving. I just want to acknowledge the challenge that you said in that circumstance, but.
Another aspect is, right, so when I was home, I was cooking. I wasn't going out to eat to like fast food restaurants and things like that. I was actually cooking my meals, meal prepping. And so making sure I incorporate eating better, healthy, and not just getting that quick snack or burger or something like that. So something else I'd like to bring.
Fantastic idea with food. Yeah. And I think you had a comment as well, Ms. Reyes.
So kind of going back to Christina, I'm kind of just wondering, could there be, because I hear what she's saying, and I currently work in student services, and there are times where what break, what lunch, what I like running to the bathroom really quick, especially between Zoom meetings when one ends at 10 and then the next one starts at 10. So they're like, well, you don't have to walk anywhere. So we'll just make them literally on top, you know, just that minute overlap. But I'm kind of wondering if maybe the district can do some type of like challenge, maybe once a month, maybe the opposite Friday of this. So this is the first Friday, maybe the third Friday. And we just do some type of challenge. And I don't know that everybody would be able to do it, but just to help with the connection I think, with the district and the employees, and saying, yes, it's okay. And yes, we're going to encourage this. And it would be maybe, you know, a set time or what have you, but just to kind of dip the toe, if you will, get something started, and then maybe we can progress from there, or maybe it stops, or maybe it stays as it is. But I think we need to try something to encourage the more physical exercises, and just and again getting that breaking away from the computers, because what I'm finding is that I'm actually on the screen more at work than I was at home. And so for me, my eye strain has gotten so bad. When I get home, I don't want to be watching TV. I don't, and I end up doing, because I need news or what have you. I want to FaceTime with my grandbabies, but I'm just like, now what do I do about my eyes? Yeah. So I just thought I'd kind of put that out there. Maybe we can do some type of challenge or something. I'm up for brainstorming.
Just want to comment two things on that. One is just what you're saying about eye strain. Every 10 minutes at least, it's so important as frequently as possible to engage your eyes away from this short two-dimensional screen. There's actually changes that happen in the eye that influences the muscles of the neck, actually, in the cervical vertebrae, that are influenced by this kind of eye strain. So it's critical to do that. And that little exercise we gave is another opportunity for little mini rest periods, you know, with your eyes over there, because it relaxes the muscles of your face. And then if there's one thing that I want to do working on campus, you know, is to help normalize relaxation exercises, both through the walking idea that you had, or through standing and doing stretching exercises. When I was in Europe, they took turns in this hospital I visited, and they actually came up and did this little brushing technique that I've shown, or little massages on the neck. And it was part of the culture to do that for each other. So I like the ideas that you're talking about.
Go ahead, Christina.
Thank you. I realized that I spoke out of turn before and I should have raised my hand, so I'm sorry. I agree with Veronica. I like that idea. The biggest thing of the reason why I said what I said, there's a lot of individuals on campus that have the freedom to come and go whenever they please, and the sense of they're not tied to a desk. So there's a lot of times where they have the ability to have some downtime, not in front of the screen and so on. But the individuals that are expected to be the front line, the anxiety of, well, like Veronica said, you know, even just going to the restroom, I mean, you've got to like hurry, because, you know, heaven forbid someone's gonna, you know, be timing you or watching you and then reporting back that supposedly you're not at your desk, and, well, they weren't there when I was there. I'm sharing this because I feel it's a real thing, and there is a huge anxiety, and there are a lot of individuals on campus. I would say a majority of them, they do hold their truth to their job, to their skills, to being there, to being present and doing a good job.
Thank you. Yeah, I have likened working in the computer sort of like I feel like I'm going into the coal mine. You know, it's like there are health hazards that are associated with long periods of time on the computer, and so I beseech the powers that be to recognize that, and to really bring in the sort of hygiene that can give you the breaks that you need there. That's a difficult circumstance. Any other thoughts about stuff that you're thinking that you want to bring back into the workplace that you learned through working at home? Great, I appreciate everybody's shares. If you have any other thoughts on that. We didn't really go into what you want to leave behind, but it might be useful to also think about that briefly. I know for me, there was a certain kind of hypervigilance and fear around, you know, not sure how to stay safe. And then when beginning to come back into groups, you know, bringing that kind of fear and hypervigilance with me. And what I wanted to share about that is, this is not a time to let down our guard in terms of healthy protocols. We looking at the numbers, we're still in a pandemic and the risks are high. And I'm seeing healthcare workers, so I know through a lot of stories through nurses and everything what's happening in terms of numbers. So it's there. But I think what can be different for me is to come up with a healthy protocol that I have both in my office, and to stick with that protocol, not reevaluate that, and then to know that we have more science that supports those protocols. So we're not living in that fear and hypervigilance. So that's something I want to leave behind. And anybody want to share about things that don't serve you or others, that was happening before that looks like as opportunity for change?
No longer in sweats.
Out with the pajamas.
Truth be told, man, I was one of them like Ugg boots, or I got my slippers on. If I knew I didn't have a meeting, man, I'm just like, hair's going to ponytail, whatever, I'm good to go. So it is good to fully care for myself and be presentable, because I am one of those that when I step out of my house, I want to be presentable. Even in my house, I want to be somewhat presentable, but when I step out, I want to be presentable. When I come to work, there are specific things that I go by, for work clothes or what have you. And so to me, it's kind of it's a discipline, but I think it's a positive discipline. And so that's one of the things I think for me is to not be so slobbish.
It's lovely. Yeah, it's really cool. I like the fact that you leave behind the slippers and the sweats, but you're going to take with you the little blankie. That's like a nice balance. Sweet. Any other thoughts about well, this I'll leave behind. It could also be something practical or something that's not serving. Any other thoughts on that?
Christina, do you have something to add?
I have anxiety going into the office. Being at home, I feel like I've been more productive. I'm not opposed to going back to the office, but because we are still in a pandemic, it gives me even more anxiety of going back in. But I do like some of these suggestions, ideas, thoughts, and ideas that everyone is throwing out there. I think that they're excellent tools. I know there was a comment about a recommendation of posting, when I'm going to be on break. I think that's a great idea. The problem is every day is so different. So trying to stick to just those breaks sometimes doesn't work. I can put up a note that I'm going to be gone for just a few moments. But again, if I put it in that I'm going to be gone for 10 minutes and it actually is longer, my anxiety goes up, because what if someone's expecting me back in 10 minutes and it's not? So there's a lot of change in going back. I hope soon we'll be out of the pandemic and we all can feel comfortable going back on campus and feeling more comfortable. There's a lot to be said about some of the companies in Europe. They definitely have hybrid schedules, that work. They still do work. This is all new for us, but we'll see what happens, and we'll try and move forward. So thank you.
Thank you for that. Any other thoughts before we close out this section of the presentation? I appreciate all the posts and suggestions that come up. My hope is it's just to generate a dialogue that you keep moving forward with. I know I was very mentally excited about getting back into the clinic. I was, and the first day was last Wednesday, but I was emotionally unprepared for the sense of, disorientation. And so we just also, want to recognize that this has been significant, and it's helpful to go back through and look at significant events that happened through that period of time. And that's an emotional processing that's really important to do. And the bottom line is to be gentle with ourselves with this transition. If we're gentle with ourselves, then we're going to be gentle with each other in our communications. So definitely a take home is, be kind to yourself, and also see if you can utilize the idea of engaging from your heart to the media, both the social media in direct interaction with others, and as well, in your standing posture and sitting posture. So thank you very much for the opportunity to share these thoughts. And with that, I'll close out my portion, stay for just a few minutes, but I'm going to back off because I actually have a patient. But I want to hear a little bit of Deborah's presentation. So with that, I'll pass it on to Deborah.
Hi, good afternoon. I'm going to be talking about stress and anxiety, some of the symptoms to look for, and some of the ways to deal with anxiety and stress. So I have a PowerPoint to share, I think. Let's see. Okay. Okay. So are you able to see this?
Yes, we are.
Okay. Yeah, there's something that's in the way. So I guess I'll do it the same way Herb did. So have you ever felt stressed? And I'm sure everyone is nodding and saying yes, of course. And I don't think that person there is using the right posture, right, Herb? So we talk about 4 types of stress. There's general stress, which everyone has this kind of stress. It's stress that typically resolves in a day or 2, and there's no intervention necessary. And I should say, there's a difference between stress and anxiety. And with stress, we can identify the stressor. With anxiety, we can't always identify what's causing the anxiety. And stress, typically, not always, but general stress, for example, will resolve once the stressor is gone. Anxiety doesn't resolve so easily. Cumulative stress is another type of stress. So it's stress that builds up in your body. It becomes more difficult to alleviate your symptoms. You may have more serious physical symptoms, and you may have more serious mental anguish. So this is stress that's kind of continuous. There is also acute traumatic stress. So this is a critical incident that happens. It produces considerable psychological distress, and it's a normal reaction to abnormal events. And then the 4th type of stress is post-traumatic stress. It's severe stress that's produced by severe psychological trauma, created by unresolved critical incident stress. And it can produce lasting changes. And so definitely for post-traumatic stress, you would want to seek some counseling and some support and assistance in dealing with that. When we experience stress, we go into a general adaptation syndrome, it's called. So in the first stage, when we experience stress, we have an alarm reaction, and this is the fight or flight response that causes you to get ready for physical activity. So the stressor happens, we go into that alarm reaction, and it decreases the effectiveness of the immune system. At the same time, it's helping us to respond to the stressor. It can affect our immune system. That's stage 1 when we encounter a stress. Stage 2 is adaptation. So if the stressor continues, the body adapts to the stressor it's being exposed to. So for example, if the stressor is starvation, the person experiences a reduced desire for physical energy and the absorption from any food. So we start to adapt to that stress. So we had the stress of the initially with the pandemic, we went into the alarm phase, and then we went into adaptation. And then the third stage is exhaustion. So if the stress continues and it's significant stress and we continue to have to adapt and deal with it, the body's resistance may be reduced or quickly collapse. People who experience long-term stress may have heart attacks, severe infections, or chronic pain or illness. So those are the three stages of how we deal with stress. And we have different symptoms for stress. So we have short-term physical symptoms. So if you experience any of these may be temporary physical reactions to stress. So dry mouth, cool skin, cold hands and feet, increased sweating, rapid breathing, faster heart rate, tense muscles, feelings of nausea, butterflies in your stomach, diarrhea, a desire to urinate. So those would be physical symptoms that we have to stress. So it's good to note those symptoms so that if you experience those, you can say, aha, that's stress. And how can I reduce my stress? So identifying the stressor and working to reduce stress. Longer term physical symptoms that you may experience from stress include insomnia, changes in appetite, sexual disorders, aches and pains, frequent colds, feelings of intense and long-term tiredness, and you may be more prone to illness. So again, paying attention, if I'm experiencing these things, maybe there's a stressor or more than one stressor that I need to focus on, and I need to find ways to reduce my stress. We also have behavioral stress symptoms. So our behavior can change as a result of stress. Some of the things we see are yawning, talking too fast, talking too loud, fiddling, twitching, nail biting, grinding teeth, drumming fingers, pacing, overreacting, being emotional, defensive, irritable, irrational, defensive again, hostile, critical, or aggressive. So noticing those things in yourself or noticing them in others can help you to identify stress and again, use some techniques to reduce that stress. Behavioral stress symptoms, these symptoms will have a negative effect on your performance by reducing your effectiveness, making you accident prone, causing you to be forgetful, causing you to be very negative. You may neglect your appearance. You may make more mistakes. Absenteeism can increase and you may make poor judgments. And then we have performance stress symptoms. You may not make good decisions if you're stressed. Your fine motor skills can be affected. You may no longer enjoy your work or school. Your attention span may be affected. You may have more negative thoughts. Your self-confidence will suffer. You may have difficulty concentrating. All of your positive energy can be consumed. So what do we do about stress? So Herb gave us some good tips, but some of the things that we can do: examine your diet and add to your diet. So examine by lowering salt intake, lower your intake of refined sugars and carbohydrates, lower your caffeine intake. So, you know, I have so many clients who come to me and tell me about their anxiety and their stress. And then when we take a look at caffeine intake, it can be like 6 cups of coffee a day. Well, that's definitely going to add to stress and add to anxiety. So those are things to take a look at. Add vegetables, fruit, complex carbohydrates, vitamins, water. Rest. Get a minimum of 6 hours of continuous rest every day. Again, I see a significant connection between sleep and mental health issues. So you definitely want to, you know, if you're not sleeping well, you want to get that under control, because that will definitely and directly affect mental health. Exercise at least 20 minutes, 5 times a week. Break a sweat to release endorphins. One of the things that exercise does for us is it helps to increase the serotonin levels in our brain, helps us to feel better. And I would suggest cardiovascular exercise. I have clients who will come in and say, well, I'm lifting weights every day, and I'm not feeling better. But it's definitely the cardiovascular exercise that's going to help increase serotonin levels and help you to have a brighter affect. Talk things out with someone you trust, a family member, a good friend, or a mental health counselor. So it's very important to reach out to others. Just talking with others can help to reduce stress and help to reduce anxiety, help us to talk through issues and find solutions. So don't hesitate to reach out. Make an increased effort to organize your life. Again, ask for help. Delegate when you need to. Learn to manage your anger. Anger affects your health, and anger causes you to overreact to many situations. So that anger can definitely happen when we're experiencing stress and we're going into that stress response. Anger happens very quickly. We go from 0 to 100 in less than a second. And so finding ways to manage your anger is very important. One of the best ways to manage anger is to leave a situation and let your body calm down. When you're angry, your body is releasing adrenaline or epinephrine. And once that's released, your body will then release norepinephrine or noradrenaline and calm you down. So just taking 15 minutes away from a situation can allow your body to calm down, and then you can come back to the situation and resolve it. If you're having an issue with someone who you have a relationship with in your personal life, you might want to talk to them about that in advance and say, you know, if I start to feel angry, I'm going to give you the timeout sign, and that means I need some time to calm down, but I do want to talk about this, and I will come back and talk about it. So managing anger is very important. We get angry often because someone did not do what we thought they should. One of the things when you take that break, you can do is to rethink the situation, maybe learn to be more flexible, or find a common solution with the other person. Practice mindfulness and meditation, which is some of what Herb was doing for us. Mindfulness is very important. I have an exercise that I share with my clients. It has 4 steps. The first step is to slowly breathe in. The second step is to notice something in your environment. The third step is to appreciate what you notice. So if you notice the sky, so blue, and appreciate that, and then slowly breathe out. So it's 4 steps: breathe in, notice, appreciate, and breathe out. So that's practicing mindfulness and breathing exercises. And when we notice something in our environment and we appreciate, that brings us into the moment. So we're not in the past, we're not in the future, worrying about things. We're in the moment. And typically the moment is okay. Fill your life with fun things to do. Keep your sense of humor. Keep a balance between work and play. All of those things are important. Take charge of your life and utilize positive thinking. So there's a whole area of psychology. It's called positive psychology, which is finding ways to kind of change our thinking and to be more positive. Don't simply react to stressful situations. So we don't want to react to a stressful situation. We want to respond. Reaction doesn't take thinking, but responding does. So if you stop, think about it, take a break, you can then respond in a healthy way. We all need a list of things that will help us to relax. So find those things you enjoy and make time for them. Relaxing meditation and breathing need to be part of a daily routine. So just breathe and relax. Any questions? Any comments?
So with the kind of going off Theresa's in the chat about the pandemic and COVID and things like that, any specific kind of guidance or anything like that to provide?
To provide for COVID? Well, it's definitely been a stressor for all of us. And I think it's important to be mindful of that and, to seek out that support and that help to engage in healthy living.
Excellent. Anybody else with any questions or anything like that for Deborah?
So
I have one.
Kristen,
Hi.
Yes. Hi.
So it's pretty much, we all don't fit into one box. And I think that's sometimes mistaken from different individuals or so ever, just to be mindful that everyone's situation is completely different.
Mm-hmm.
And to be respectful of that. Whatever their belief is, or whatever and however they're feeling, it may not be your situation, but to have empathy, to be able to understand, support, and do whatever you can to help each other out.
Yes.
And to be able to accommodate for everyone's situations. until we get out of this craziness.
Right.
And even out of once we're out, even in other situations. So thank you for all of your information. It was interesting.
Of course. Yeah, and I think that listening is a big part of what you're talking about, you know, to really listen to what someone else is saying, to not have in your head what you're going to say, but to stop and really listen to what someone else's needs are or what accommodations they may need in dealing with this situation.
Excellent. Well, thank you so much, Deborah, for joining and participating in this month's PD.
Okay, you're welcome. Thank you.
All right. So everybody, thank you so much for attending the session. Thank you so much for everybody that participated and provided input. Again, Veronica, great idea on the Get Up and Move challenge. I have some ideas incorporating that, maybe department-wide, we can have some step challenge or something like that. I'll look into that, but definitely great idea and input. I brought this session in because no matter what other tools that I try to provide during a professional development session, if you're not mentally and physically ready for the workday and to come in and understand, have self-awareness, then anything else I bring, you know, won't help. You know, it's important to have that awareness of your mental health and also to utilize the tools that we all have as a resource. So it was very important that I bring this in. You know, I took away some excellent takeaways. You know, thank you so much, Deborah, for that great insight into stress and anxiety. And again, the posture awareness, I need to definitely have that string going to the computer monitor and stand up, and I will definitely incorporate that into my daily routine. So again, I appreciate everybody so much for attending this session. I'll have this recorded and it'll be on Keenan for anybody that would like to watch it over. Again, next month's session will be November 5th, and the topic is to be determined. As always, please feel free to email me any session ideas. And other than that, thank you so much. Everybody have a great Friday, and I will have a great weekend, and we'll see you Monday.
Thank you. Appreciate it.